have a question here from the audience here in the hall, and Rich, maybe you could take this. The question is, I remember a panel some years ago being as optimistic about electronic voting as this panel is about electronic health records. Electronic voting has mostly been discredited for various reasons. What might be the pitfalls, Rich, in electronic health records? Are electronic health records kind of the personal jetpack of the 21st century?
You know, I think the privacy concerns are foremost, and the question about control of the data and what people are using it for. You know, I think that's the downside. I think, though, you know, looking at the model of the financial industry where you do have access and you're able, and it's data from all over the place, and they don't have interoperability between all of financial services, and the ability to take that and make use of it and to use whatever tools on that data, I think far outweighs, you know, the issue. I think we'll have electronic health records way before we have electronic voting, for good or bad.
Gail?
Just for VA, it was really a team effort with the clinicians getting extended encounter times when they came up on the electronic health record. So I do think we have to stop and say, can this really happen in a small physician office? Can they really take the hit of extending appointment times from 20 to 30 minutes, for example? The other thing that you brought up earlier, this also, we called it help at the elbow, but I think we all call it something different. In VA, they're clinical application coordinators. But they were truly people that when clinicians were having a problem with the system or had questions, they could call them immediately and get help. And I do think that we have to find ways to do that for the small physician office, and I think we've mastered it in larger integrated healthcare organizations, but kind of taking different models of that, I think, is essential.
I would say if we don't reform healthcare at the same time, then it just becomes another additive, expensive technology.
If you want a doctor to spend 20 more minutes, you're going to have to pay them for that. I mean, and my philosophy is then we should. Yeah. Because the issue is that information is very, very critical to care and outcome. I mean, right now the system isn't designed to reward that, and so I think it's true. You're going to have a lot of other reforms, including payment reform, if you really want to see the robust use of electronic medical records.
This is just one tool in a broader debate about how you improve the healthcare system. We, with this tool and a number of other interventions, we're actually lowering the panel size, increasing the amount of time that we expect our primary care providers to spend with each one of their patients, because we know that that kind of access to our primary care providers overall promotes better health and lower expenses for our system as a system. Now, there are just so few parts of our healthcare system that are reimbursed within a payment mechanism like that. It's just very difficult to create the economic imperative for that change more broadly.
Yeah.